Hello and welcome to Inside the Lab, a program bringing you the latest information on autism research, both local and international. I'm Dr. Josephine Barbaro. I'm a postdoctoral research fellow at the Olga Tennyson Autism Research Centre at La Trobe University. And today I'm thrilled to be bringing you two internationally renowned autism experts. I'd like to welcome Professor Catherine Lort and also Dr. Andy Shee.
Pleasure.
Thank you both for being here today. So today, Kathy, could you just tell us a little bit about your current position and the background of autism research that you've been working on?
I'm the director of the Center for Autism and the Developing Brain, which is a collaborative effort of Weill Cornell Medical School, Columbia Medical School, and New York Presbyterian, and then with the help of a not-for-profit called New York Collaborates for Autism, which was started by a group of parents of kids with autism.
Mm-hmm. And Andy, can you tell us a little bit about Autism Speaks and your position within there?
Sure. Autism Speaks is a global NGO. We're dedicated to supporting autism awareness research and service development. My role is a Senior Vice President of Scientific Affairs, kind of a nebulous title, which means that I do a little bit of everything, but primarily I'm focusing on public health initiatives and programs now.
Yes, and certainly travelling all around the world doing so. It really is truly amazing work. So today will be the 6th episode of Inside the Lab, and we'll be focusing on early autism spectrum disorder and global knowledge transfer. So we have two events this week. We have the Menzies Foundation Symposium on early autism spectrum disorder, covering early diagnosis, detection and intervention. And we also have the Australasian Society for Autism Research Conference here in Melbourne. Kathy, I'll start with you. Can you tell us a little bit about speaking there?
Yes, we started a study over 20 years ago where we followed 200 consecutive referrals of children under the age of 3 who were coming for their first assessment for autism, and then also a group of kids who had other developmental disabilities. And we've been able to follow this group now up to they're 22 years old. So I'll be talking about how the children changed and how we can use that information to think about both early intervention and the things that we do with families and with kids with autism as they grow older.
Wonderful. And can you give us a rundown of some of the results you found so far?
Well, I think initially we were interested in, can autism be diagnosed in children as young as 2? And the answer was yes, in fact. There is change, but in fact we could do a quite good job of figuring out who had autism and who didn't.
Yeah.
As the kids have gotten older, we've been interested in what are the factors that determine who gets better and in what ways. And I think mostly we've found very good things. We've found that most children with autism become less aggressive, become less active, less irritable as they grow older. A much higher proportion of kids, even in this community sample, have developed language than we expected. And their academic achievement is better.
Yeah, and we've certainly found in our own research where we have provided diagnoses of children 2 years of age and younger, that at 2 years of age, 80% of these children had developmental and language delays, and now we've followed them up until 9 years of age, and only 10% of these children actually have developmental and language delays and having an IQ of less than 70. So it's certainly in line with what you're finding with your longitudinal studies.
That's right.
You'll also be giving a keynote on regression and worsening in autism spectrum disorders at the International Society for Autism Conference. Can you give us a rundown about what you'll be talking about and also the findings that you've had so far?
So one of the most interesting things, but also devastating things about autism is that many children appear to lose skills between the time when they're about 12 months old and 2. And so we don't know why that's happening, but I think that many people have been concerned that something in addition is going wrong that's causing that loss. And we were able to do a study where we looked for children who were very young, who someone was concerned might have autism or be at risk for autism because they had a brother or sister with autism, and follow them very closely over that period from about 14, 15 months up to age 3. And what we did discover was, in fact, many kids did lose skills. Many of those skills do come back gradually, but it didn't it wasn't associated with any particular event, like a vaccination or something going awry. And it does seem to be characteristic of autism that those social skills change in that infant toddler period.
Yeah. And are you also finding that there's not necessarily a complete loss of skills, but maybe a plateau, or that a child was saying, for example, mama, dada at 12 months of age and made some more eye contact, but then parents sort of report that there was this sort of gradual loss or plateau in these skills. Are you also finding that?
Yes. I mean, I think that looking at what's going on, it's much more complicated than just having a skill, absolutely losing it, and it's gone. So children range a lot in what they can do before this occurs. They range in how many skills are lost. Some kids just talk less. Some kids keep talking. Some kids never were talking and don't develop language till later. So there's quite a lot of variability, but it does seem like something often shifts during that second year of life.
Yeah, and are you finding that it's more in the early stages, so around 12 to 18 months of age, or you feel that it also does pass that 18 month of age as well?
I think that probably most of it occurs earlier, but it's hard to see. And in fact, one of the things we learned was that clinicians seeing a child once a month and parents were much less good at pinpointing when things were changing than actually making videotapes, scoring the videotapes, and looking what was happening.
Yeah.
You know, we see so many things when we look at a child that include not just what they're doing now, but what they used to do and what we hope they'll do, that it's quite hard to make sense of that sometimes.
Yeah. And Andy, you have a large focus on global public health awareness of ASD, including raising awareness, advocacy, and research globally. Can you tell us about the Global Autism Public Health Initiative that you're involved with, and we'll talk about at the ASFAR conference?
Sure. So as you know, I came into public health rather late, and some of my friends in public health tease me as saying I'm a reformed scientist. I used to be in basic research, but I think over the years it became, as we increase awareness globally as part of the advocacy organization, it also became more aware of the fact that demands for services has increased as well. And many times these demands for services are occurring in environments or a community where there's very little expertise or capacity to provide those support. So what we're trying to do is both to raise awareness at the community level and at the political level, so we can hopefully encourage policy reform, policy change, but at the same time to invest in research that could actually develop real-world solutions that can operate in the community and provide benefits to these families. And this is actually one of the reasons that I was so intrigued in our conversation this morning about the work that you do, which is really more community-based than laboratory-based. I do think we need more in this area than has been traditionally supported. I think for me, one of the realization, and this may seem obvious to many people, but for me it was it was kind of a duh moment, because I learned 4 or 5 years ago, someone pointed out to me that, do you know that actually more than 85% of our families live in low and middle income countries, where there are actually very little solutions and infrastructure support to address their needs.
Yeah.
So I think that's really the motivation behind the work that we're carrying on at this point.
Yeah, and that is the conundrum that we do face as researchers and also practitioners, is to try and disseminate this knowledge that we have into these communities. We could have the best autism diagnostic tools, the identification tools, intervention techniques, but if we're only focusing on a very small percentage of the world's population, then we really are, I guess, not doing the best that we possibly can. So I think that's such an important initiative that you are doing with Autism Speaks. And the community-based research that we are doing here at OTARC with early identification within our maternal child health system, I think is really important, because we're not only identifying children with autism early and diagnosing early, but we're also educating our healthcare professionals and giving them the tools to be able to then pass that knowledge on to the next generation of healthcare professionals. So I think that's really important work that Autism Speaks is doing there.
Oh, thank you. I mean, I agree with you. I think that I mean, obviously the work that's being done by you and certainly eminent researchers like Dr. Lohr is critically important in helping us get the basic understanding what autism is and how we can be helpful. But I think from my perspective, what's been missing in the community is really that more direct link between what's happening in the laboratory and what's happening in the community.
Definitely.
Because the real world is messy and you can't control every variables. So in addition to doing the science, you need to try to understand what are other factors in a community and society that could actually influence the impact of an intervention developing or a new diagnostic scheme you're considering. Because at the end of the day, at least from my perspective, Autism Speaks, what we want to do is to deliver answer to family that are meaningful to them in their daily lives.
Yes, absolutely, yeah. And you'll also be covering community-based participatory research and the development of feasible, accessible and sustainable services at the Menzies Symposium. What are some of the case studies that you've been involved with at Autism Speaks?
Right, so we started investing in this area, implementation science, community-based participatory research about 3-4 years ago. We had a call for proposal globally. And some of those studies are just coming to an end right now. But what I'll be focusing on actually 2 projects that are part of this wave of research that we've been funding. One is focusing actually, interestingly enough, in our own backyard in New York City. I think the point there is that underserved community is underserved community, and it's really not about geography or anything else like that. And we understand that in New York City there's a diverse immigrant population, and many of these families still speak a different language than English as a primary language at home. I think over 50% in New York City immigrant community. So we want to understand what is their attitude or what are the barriers potentially, both logistical as well as cultural, that could inhibit access to care or help-seeking behavior. And so the first case study is really the process in which we try to understand both from a cultural as well as a logistical perspective in terms of what are the challenges for families who are concerned about their child development. And the second example case study I will share is more recent and is still is concluding at this point. It's a project we funded for WHO to try to develop community-based mental health services, including for children with special needs in low-income country, and this was done in Sri Lanka. And I think for me, what is interesting is that even though one is in New York City, major cosmopolitan metropolitan, and the other one is in more rural areas of Sri Lanka, the approach that we've taken in terms of trying to understand the needs, trying to engage community as partners in developing solutions, something that they could own and embrace over time, is very similar. And I like to think that, I think based on the preliminary outcome that we're seeing, is that that will actually shorten the time from when research and laboratory have an idea and a new insight into an opportunity to be able to translate that, implement it as a community-based solution. Hopefully with this kind of approach, that time it takes will be much shorter.
Yeah. I think it's really important. It does take quite a long time, from lab to community, doesn't it? Yeah. And so, Kathy, being the developer of autism, the gold standard autism diagnostic tools such as the ADOS and the ADI, how do you think that we can try to develop and disseminate tools such as this, or to modify these tools, so that developing countries or low resource settings, places with low resource settings, can actually use these types of tools and have access to these types of tools?
I mean, I think those are really important questions. And, the tools that we have were originally developed for research with highly trained researchers, and then they had been modified some of them have been modified more for clinicians, but they still do require a lot of time and energy and work, and then expense in terms of purchasing the materials. And so I don't think anybody has actually carefully looked at those tools and said, all right, how could we make them more usable? What we have are tools sort of from the bottom up of looking at, what can we do with communities, which I think are very, very important, including your measure. And then ideally what we would do is meet in the middle somehow, of figure out, what do we do as the first round? What do we do at the last round? And then how do we get to that middle where we can make things more efficient, more scalable? And then where do we lose and where do we gain? And I don't think it's a simple question, because part of it is also that with the tools comes skill. I mean, that's been true, I think, as you found too, for the health professionals that use the SAC. They learn to do things. It's not just that they're filling in the check boxes, but they're learning to look for things. So what do we need to learn to look for? What is enough? What is not enough? And when do we lose things by going too quickly? But then when are we just adding burden by sticking to the old stuff?
Yeah, definitely. And just to put it into perspective, the SAC, the Social Attention and Communication Surveillance, is a tool that I developed as part of my PhD to try and identify children as early as we possibly can that have autism in our community-based centres. So maternal child health nurses were trained on these very early signs, and if a child came up as at risk for autism, then they were referred to us at La Trobe, and then we conducted developmental assessments at multiple time points. So we found that was much more effective in identifying children early than using, say, a screening tool at one age, because as we all know, autism is a developmental condition that develops across time. So I think that's one of the ways forward, I think, rather than sort of developing a screening tool, a parental questionnaire that you give to parents and then they have to fill out. Do you feel that is the way forward for early detection of autism? Because we are struggling with finding a screening tool that we can use universally. There are low rates of actually identifying children with autism and high false positives. Do you think that is perhaps the way that we should be moving towards?
I think a couple elements of the things you said. One is being able to monitor change, because the question isn't so much what is the child doing today, but is if he's doing something that's unusual or not doing something we'd expect, is he still not doing it in 2 weeks or a month? And that, I think, is much more powerful. I think another important element there is, what are the parents thinking in the middle of this? And so I think if you just do a screen, that's not enough for parents. And this is something that's going to change how they think about their child. It's going to change if they take it seriously.
Yeah.
If they don't take it seriously, it's not good either. So how do you include parents in those beginning observations and discussions so that they leave, whether they leave this process with a diagnosis or just an understanding that their child actually doesn't realize when they're waving their hand or pointing that means they're supposed to be looking over there.
Exactly.
Or the child really doesn't understand what they're saying. It's not that the child is deliberately misbehaving, but that they actually don't understand. So I think both of those factors, the trajectory and how do you include the parent in the process, are very, very important.
No, I agree. And actually, just to go back to the point that both of you made a little earlier, actually, this reminded me of a conversation I had with Kathy in San Sebastian MFAR conference 2 years ago now. And for me, it was an important conversation, because I think what Kathy highlighted was that you need to think about what is the purpose of a diagnosis and or screening. Obviously, ADOS was developed, as Kathy mentioned, primarily for research originally, even though now it's been used in different settings. But let's say if your goal is to identify children as early as possible and get them into some kind of intervention support, so there's almost like a prevention element to it in terms of hopefully steering the child to a better outcome than a worse outcome. Then do you really need a sophisticated tool like ADOS? An idea that Kathy was kicking around, I thought was actually really interesting, was that maybe the thing to do is to raise awareness broadly in the community, and then if the parent is concerned about child development, and then you can get an independent verification from another party, a teacher or another relative, maybe that's good enough in order to get the child into some kind of support right away. So I do think that what the intention and purposes are, and that would dictate the kind of tools you may want to use. So maybe the answer is not any one particular tool, but maybe a toolkit or toolbox, right? Where you can pull elements from it as you need them for different situations.
That's right, exactly, according to the setting that you're in, really. And if we can move away, I guess, from this notion of having to have a diagnosis to access services, that it really is based on need. So that if you do identify even, a child at 12 months of age that is showing some subtle difficulties, if we can intervene at that stage and start to teach the child and teach the parents to engage with that child in the way that that child learns, then that may place them on that trajectory that is sufficient rather than having to give that diagnosis. And I think that that's really important. It's more about identifying how these children learn rather than necessarily giving an autism diagnosis per se at these early ages. Yeah. So, Kathy and Andy, I'll direct this question to both of you. So being in Australia, we're obviously physically quite far away from the rest of the autism research community, particularly the US and UK, where a huge proportion of autism research is carried out. And we find that even with publishing our research in international peer-reviewed journals and presence at international conferences, that it still can be difficult to disseminate, I guess, word on autism research. And this isn't specific to Australia, it would be other countries as well, particularly non-English speaking countries. So I'm wondering, what do you think is the way forward in which that we can, I guess, disseminate research from these other countries more broadly to the autism research community?
I think part of the problem is sample sizes. So it's that because children and adults with autism are so diverse and not all the same, it's very hard to study them unless you have enough of them. And so I think one of the things that's happened in the US and in the UK and Canada, and I think is beginning to happen in Australia too, is people coming together to do projects that allow a number of people to study the same sample, but also to have larger groups, because it's very hard just realistically to get something published, and it's hard to even know what you get. I mean, there was a recent analysis, I don't know if you saw it, I think it was done by some Israeli professors about imaging studies of autism that basically showed that the smaller your sample size, the more likely you are to get a positive result that no one ever replicates. And so I think the implication of that is people have to pull together. And that's hard, and it actually in some ways requires more money and more funding, because you have people who have to communicate with each other and they have to agree on what are you going to do, that everyone's going to do the same, and then you have to be willing to say, all right, if you want to study this, I'll do this, but I want you to do this so that we can get information. So I think that's something that will help, because we're more conscious of how limited our results are when they're based on a very small number of children. And I mean, I'm preaching to the choir, talking to you, because you've just done this huge study, or are in the midst of a huge study as well. But I think that's part of the problem. That's hard for people, outside of the U.S. and Europe. I don't know.
No, I agree with that, and I think maybe the other things that, as a community, that we can do. Certainly, having eminent scientists like Kathy, participating in conferences, I think is an important mechanism for disseminating the latest insight and understanding about autism research. I also think that now it's less of a challenge, I think, to get on a plane, to go somewhere, or to organize a meeting. I think more of that is welcome. Certainly, I think professional society, like the Australian Society for Autism Research and International Society for Autism Research, has an important role in terms of disseminating information and findings. INSAR, for instance, they've been toying around for a couple of years now, the idea whether or not they need to have meetings in addition to the more traditional one that typically held in North America and and Western Europe. Actually, I remember a vivid conversation with Helen Tager-Flusberg, who, when she became president of INSAR, told me that she feels the International Society for Autism Research, international doesn't mean North America and Western Europe only. So I think the happy conclusion of that is that INSAR is now starting to host and organize regional meetings now, which will both give a more established researchers, more senior researchers in North America and Western Europe an opportunity to disseminate their finding. But just as important is for the autism research community in those territories now to learn from the young up-and-coming investigators, the different perspectives that researchers and educators and policy makers may have about autism research. So I think having that kind of venue where you can encourage knowledge exchange and perhaps foster collaboration is very important.
Yeah, I think that's the key, fostering collaborations, not only internationally but within your own communities as well. Australia is a very big country, and you know, we are quite far away from each other. So with this you know, Autism Cooperative Research Centre that has started up, I think that that's certainly one of the first steps and most important steps, so that we can all collaborate and share knowledge and pool our resources and pool participants as well, because that can be quite difficult given we do have a relatively small population compared to other countries as well. And you were talking about how the next upcoming regional INFA is going to be in Shanghai next year.
That's right. It's going to be November 6th to the 9th in Shanghai, China. Yep. And I think INSAR just made that decision less than a month ago. So we're quite excited and looking forward to help making that a great success.
Yeah, and it'll be wonderful to attend and to be within that community as well, and to chat with them about the latest research happening in the Australasian Pacific as well.
Exactly.
So do you think that, we touched on this before about early diagnosis, so I guess when we say early we mean diagnosis under 3 years of age, and there is still some people within the literature that argue that we shouldn't be diagnosing under 3 because of the lack of stability for a diagnosis, for example. However, I feel that is quite a small percentage, and for a large proportion diagnosis actually remains stable, and for those that do actually move off the spectrum, they do continue to have some difficulties, but actually we've been able to intervene early. What is your position on that? Do you feel that we should continue to try and push for diagnosing as early as we can feasibly do so?
Yes, I do. I guess I feel that we can make diagnoses of kids certainly at 2 and often even earlier. We do need to be aware that those diagnoses are more likely to change than at later points in development. And we certainly want to be very clear that a diagnosis should not take away hope that this individual is going to be a productive, happy, competent person. And so I think I would try to separate the consequences of the diagnosis, which can be quite frightening, and trying to help families understand that the consequences are not as devastating as they might initially feel, from the fact that it is, I think, really valuable for parents to understand why their child is behaving in the ways they are, and what are the things that are likely to change, and what are things that might not change if they don't do something differently. I think that is different, as you said, from getting into early intervention. And so a child can get help without a diagnosis. But I think what a diagnosis does is give us, in sort of shorthand, major features about that individual that would affect how we treat them. And so whether it comes in the form of a diagnostic term, or it comes in terms of the interventionist knowing, I need to work on this, I need to be sure the child is looking at me before I talk to them, I think matters less than that understanding. And again, back to what Andy was saying in our previous conversation, I think that at least in the US, people are so much more aware of autism. They don't always know exactly what it means, but they have some idea that there are people that have difficulties with these very basic social behaviors, and that you do need to do some different things with those people.
Yeah.
And so I think that's where the early diagnosis is most important, is giving families a sense of what's different and what they can do to make that better.
Yeah.
Yeah, I couldn't agree with that more. I think the important element is to, as Kathy said, to separate the diagnosis and the potential implication from hope, right? That their child could become a happy, independent, productive individual member of society. And I think that I can also appreciate in some communities where having a diagnosis earlier may not necessarily be beneficial to the child or the family, especially in community where there's little services, for example. At that point, adding a label may not necessarily help the child. I think at least we're accustomed to the notion that, at least in the US, if you have a diagnosis, then there are steps that you can take to help address these needs. But if there isn't, what do you do at that time?
Yeah.
And then, how do you help this family to address the challenges that this family faces with their child, at the same time, without adding to the potential stigma and the social isolation that could come with such a label in a low resource environment.
Yeah, definitely. And I think that notion of hope is really important. And I guess even in settings in which there aren't many formal avenues for early intervention, for example, that there is at least an avenue for parents to seek help if they need, in terms of figuring out what exactly is the difficulty with their child's development, because they can often blame themselves and feel that they are somehow causing the developmental issues. And so by being able to at least have that discussion with the parents and say, actually, look, it's not anything that you're doing, it seems as if your child is developing autism, and here are at least some strategies that you can do within the home with your child, because we often overlook, I think, the mental health of parents following a diagnosis, and also pre-diagnosis. They can often go doctor shopping from one doctor to another, not knowing exactly what is quite right with their child's development or different about their child's development. And I think that's definitely an important avenue that we need to go down, not only providing a diagnosis for children, but at the same time providing support services for families at the point of diagnosis, especially at those young ages. Yeah. So, Andy, do you think it would be possible to disseminate this knowledge about, I guess, early detection, diagnosis and intervention in these low resource settings?
I think it's possible, but I think, as Kathy pointed out earlier, I think this kind of scientific enterprise is no longer a solitary pursuit, right? It's not really about a brain researchers going out to the field and having a eureka moment or anything like that. It's really about engaging the entire community, the different stakeholders, and really helping the entire community understand, what the issues are and what the possible solutions may be. Because if you only focus on part of the community, there's always going to be resistance or a failure to understand what you're trying to do and why that's important for members of your community. We funded a project, for example, in Ethiopia 3 years ago. And this is along with 4 other projects in other lower middle income countries, or environments, shall I say, including actually one in the United States, in rural Colorado. And I tell you, when the Ethiopia project started, I was pretty sure it wasn't going to make it, because when we had the first report, update report with the PIs, it was just the obstacle they were running into, from stigma to lack of understanding, to even some of the local experts saying, autism is an American disease, it doesn't happen in Africa. I really had doubts whether or not that's going to be successful. But 3 years down the road, what you see is that these researchers really embrace the local stakeholders, the families, the physicians, the educators, even the policymakers, and share with them every step of the way in terms of what they're trying to do and how the challenge they're encountering, and looking for help in terms of finding solutions. So this way you engage the entire community in your process, in your project, they have some ownership into the outcome. And what is happening now is that there's tremendous increase in awareness, at least at the grassroots level in Ethiopia, about developmental disabilities in general, and autism specifically. To the extent that Ethiopia government Ministry of Health just recently hosted a mental health summit, which is something that's very rare in sub-Saharan Africa. So I do think it's possible, but it really need to, they say it takes a village. I would say it takes a country, right, to really think these issues through and try to make sure that we come up with solutions that are meaningful and that can be embraced by all the stakeholders.
Yeah, and so it seems that the key theme really is engaging communities, and it's not just about going over there and imposing your research or agenda on a particular country, but it is about working with communities from the ground up and knowing what their specific needs are, and their needs are going to be different from our needs as well. So I think being sensitive to that is really key. So thank you so much both for being with us today and for this really interesting discussion on early autism and global knowledge transfer on autism. And thank you to our viewers for joining us today for the episode on Inside the Lab. Thank you.